Meet Miss Jones. Miss Jones is dealing with pain in her groin area with no specific mechanisms of injury. Symptoms include painful deep squatting and getting into a car, pain after sitting or getting up from a chair, painful moving side to side, and painful twisting. These symptoms lead to believe that Miss Jones is dealing with hip impingement. There are two types of impingement: pincer deformity, in which an abnormal acetabulum covers the femoral head, or a cam deformity, in which the femoral head is abnormally shaped, causing premature contact with the acetabulum. People can be affected by either deformity. It is common to have a combination of both.
When FAI symptoms become too severe, there are many options to treat it. The two ways we'll be talking about today are physical therapy and surgery. Conservative treatment. For conservative management, we're going to be listening to a physical therapist on her advice on how to treat FAI. A few things you can do to treat FAI conservatively is to modify or avoid painful activities, address strength and flexibility issues, avoid repetitive flexion, internal rotation, and abduction, and target all planes of motions with a specific emphasis on transverse and frontal planes. A few exercises you can do to strengthen muscles around the hip are clamshells, side-lying straight leg raises, and side steps. Progressions for these exercises all include a TheraBand for added resistance. Some more exercises include bilateral bridging, single leg bridging, which is a progression of bilateral bridging, and step downs. The case report published in the Journal of Orthopedic and Sports Physical Therapy suggests the use of soft tissue mobilization of the muscles surrounding the hip, mobilization of the hip, and dry needling.
If conservative measures fail, surgery may be indicated to manage deformities and lesions associated with FAI. Arthroscopy is a minimally invasive procedure done to examine and treat FAI. Reverse periacetabular osteotomy, direct anterior open approach, and surgical hip dislocation are more invasive procedures that may be done to treat FAI, depending on surgeon preference and the deformities present. Post-operative rehab generally consists of 4 phases. In the first phase, the focus will be on protecting the joint and maintaining range of motion. The second phase will focus on gait pattern and restoring full range of motion. The third phase will focus on strength and conditioning, and in the fourth phase, the focus will be on returning to pre-injury sport and recreational level.
These are some examples of criteria to return to sport.
Created using Powtoon.